Hi, I am Dr. Praveen Vodala, one of the first year psychiatry residents. Today I am here to talk about obsessive compulsive disorder, commonly known as OCD. So what is OCD? It is a condition with diverse group of symptoms that include intrusive thoughts, rituals, preoccupations and compulsions. Obsessions are intrusive and unwanted repetitive thoughts, urges or impulses that often lead to a marked increase in anxiety or distress. Compulsions are repetitive behaviors or mental acts that are done in response to obsessions. What are the most common type of compulsions and obsessions? The most common pattern is an obsession of contamination, followed by washing or accompanied by compulsive avoidance of the presumably contaminated object. The second most common pattern is an obsession of doubt, which is followed by compulsions of checking. The checking may involve multiple trips back to the house to check whether the stove is turned off or whether the door is locked. So how common is OCD? Well, the lifetime prevalence in the general population is estimated to be around 2 to 3%, with roughly equal number of male and female patients. The mean age of onset is about 19 years. The onset typically occurs in adolescence or childhood, and the onset after age 30 is rare. So why should we treat this condition? Well, the course of OCD is generally chronic, and in the absence of intervention, symptoms may persist for decades. The recurrent obsessions or compulsions cause severe distress and anxiety to the person. They are time consuming and interfere significantly with the person's routine, occupational functioning, usual social activities or relationships. So how do we treat this? There are three ways to treat it, either with therapies, with drugs, or a combination of both. The most effective therapy for OCD is exposure and response prevention, which is a type of cognitive behavioral therapy. It involves avoidance of distressing cues, encouraging in vivo exposure to feared situations, and imaginal exposure to the feared consequences, and finally, not to engage in the usual compulsive response. Coming to the drugs, the two most commonly used drugs in the treatment are clomipramine and SSRIs. These are the medications that are usually used in the treatment of anxiety and depression. The third method is a combination of therapy and drugs. That is all I have regarding OCD, and I hope the information is useful. Thank you so much.